Signs of angina. People feel severe pain in the chest. It's not like what movies show, where the person holds the left side of their chest. It's not always like that. On the contrary, sometimes it comes in the pit of the stomach. The place where the severe pain occurs can be at the pit of the stomach. I like most of the patients. The second point is that the pain isn't localized to a single spot that you can point to with one finger. That is, angina is pain in the chest. It can be in the middle of the chest, this is the most common, or it can be on the left side, and sometimes it radiates to the left shoulder. It can radiate to the left arm, or even to the lower jaw or the neck. It is often accompanied by discomfort in breathing, shortness of breath, or what we call labored breathing. It can also be associated with very heavy sweating. People who experience these kinds of symptoms, if he is sick and is being supported by a doctor, he will not understand how to act. If he has a blood pressure monitor, he checks his blood pressure to make sure it's okay, or just slightly elevated. He chews an aspirin as he heads to the nearest hospital. He doesn't just chew the children's aspirin and stay at home. He should chew the aspirin and go straight to the nearest hospital. But if he's not a patient, has never been to a doctor in his life, and no one has ever told him what to do, if you experience the symptoms I just described, you should go straight to the nearest hospital. Never say, no, I'll just take a painkiller. Especially with this new kind of chest pain that's 10 out of 10, or even more than 10 out of 10, with severe tightness, as if someone is sitting on your chest and you can't breathe, with pain radiating to these areas. With sweating, please go to the nearest hospital. These are the symptoms.
Does it always present like this, or can it vary? You mentioned it could be in the pit of the stomach. Does pain in the pit of the stomach also come with pain in the left shoulder and left arm and all of that, or does it come on its own, just so people can tell the difference?
The symptoms of stable angina. They can include all the symptoms I just described together, and they are triggered by exertion and relieved by rest by simply sitting down. When the patient exerts themselves physically, they start to feel these symptoms. When they sit down, the symptoms begin to disappear. Over time, the patient learns that these are the symptoms of angina. Okay, in this area, I could also have something like gastritis. This area, the epigastric region, when I experience severe pain there, it could very well be due to inflammation of the stomach. But how would I know while I'm sitting at home? Because it's possible for this area to hurt without sweating and without the pain radiating to the left arm or left side, and it could still be the onset of angina or even unstable angina. It's not necessary for all these symptoms to be present, and they don't always have to be related to physical exertion. It could just be that I have pain here, and maybe I don't even get the pain exactly as I described. So how would I know if it's my stomach, my pancreas, or my heart? We'll never know it.
So, just to clarify without interrupting you, if someone experiences severe pain in this area or at the points you mentioned, pain that is unbearable, all these points mean you should go to the hospital, right? Exactly, that's right.